Question 1. A nurse is caring for a client admitted with acute exacerbation of Crohn's disease. The client has been receiving total parenteral nutrition, TPN, for 3 days. Which assessment finding requires the nurse's immediate attention? A. Blood glucose level of 180 mg per deciliter. B. Report of cramping abdominal pain after eating toast. C. Temperature of 101.8 degrees Fahrenheit 38.8 degrees Celsius and chills. D. Daily weight gain of 1.5 kilograms 3.3 pounds. Answer: C. Temperature of 101.8 degrees Fahrenheit 38.8 degrees Celsius and chills. This question tests the nurse's ability to prioritize complications in a client receiving TPN. The keywords immediate attention indicate a need to identify the most life-threatening finding. A temperature of 101.8 degrees Fahrenheit with chills in a client on TPN strongly suggests a central line-associated bloodstream infection, CLABSI, which is a severe and rapid complication requiring immediate intervention to prevent sepsis. While the other options represent concerns, hyperglycemia, refeeding syndrome, intolerance to oral intake, infection poses the most acute and dangerous threat to the client's life. Always prioritize signs of systemic infection, especially when an invasive line is present, as they can quickly lead to shock. Question 2. The nurse is preparing to administer packed red blood cells to a client. Which action is the priority before initiating the transfusion? A. Administering a prescribed antihistamine to prevent an allergic reaction. B. Verifying the client's identity and blood compatibility with another registered nurse. C. Documenting the client's baseline vital signs in the electronic health record. D. Ensuring the blood product is warm to room temperature before infusion. Answer: B. Verifying the client's identity and blood compatibility with another registered nurse. This question evaluates the nurse's understanding of critical safety protocols for blood transfusions. The keyword priority directs the nurse to the most crucial step that directly prevents life-threatening errors. Verifying the client's identity and blood compatibility with another registered nurse is a mandatory double-check to prevent administering incompatible blood, which can lead to a fatal hemolytic transfusion reaction. While the other actions are important aspects of safe transfusion, confirming correct client and blood product match is the absolute priority to ensure client safety. Always remember, the ultimate safety check for blood transfusions involves meticulous verification by 2 qualified individuals. Question 3. A client with chronic kidney disease, CKD, on hemodialysis reports increasing fatigue, shortness of breath, and feeling cold. The nurse notes pale conjunctiva and a heart rate of 98 bpm. Which laboratory result would the nurse anticipate and report immediately to the healthcare provider? A. Serum potassium 5.8 milliequivalent/L. B. Hemoglobin 7.2 g/dl. C. Blood urea nitrogen, BUN, 85 mg per deciliter. D. Serum creatinine 6.5 mg per deciliter. Answer: B. Hemoglobin 7.2 g/dl. This question tests the nurse's ability to connect a client's symptoms with relevant laboratory findings in chronic kidney disease. The symptoms of increasing fatigue, shortness of breath, pallor, and tachycardia are classic signs of severe anemia, which is a common complication of CKD due to decreased erythropoietin production. A hemoglobin level of 7.2 g/dl is critically low and directly explains these symptoms, requiring immediate medical attention, potentially for a blood transfusion. While elevated potassium, BUN, and creatinine are expected findings in CKD clients on dialysis, this hemoglobin level, coupled with severe symptomatic anemia, presents the most immediate threat to organ perfusion and warrants urgent intervention. Prioritize addressing physiological signs of distress that directly correlate with critical lab values. Question 4. A client post-appendectomy is discharged with a prescription for oral opioid analgesics for pain management. The nurse provides discharge teaching. Which statement by the client indicates a need for further instruction? A. I should take a stool softener every day to prevent constipation. B. I will avoid driving or operating heavy machinery while taking this medication. C. I can crush the extended-release opioid tablets if I have trouble swallowing them. D. If my pain is severe, I should take the medication at the prescribed interval, not just when it becomes unbearable. Answer: C. I can crush the extended-release opioid tablets if I have trouble swallowing them. This question assesses the client's understanding of safe opioid administration, specifically concerning extended-release formulations. The phrase "further instruction" indicates looking for an incorrect statement made by the client. Crushing extended-release tablets can lead to dose dumping, where the entire dose is absorbed immediately, potentially causing respiratory depression and overdose, which is extremely dangerous. The other statements demonstrate correct understanding regarding managing side effects, constipation, safety precautions, impaired judgment, and proper pain management techniques. Always emphasize that extended-release medications, especially opioids, must be swallowed whole to ensure proper absorption and safety. Question 5. The nurse is caring for a client with a history of alcohol use disorder who is admitted for pneumonia. On the second day, the client becomes agitated, confused, and reports seeing bugs on the wall. The nurse observes tremors and diaphoresis. Which medication should the nurse anticipate administering first? A. Haloperidol, Haldol. B. Lorazepam, Ativan. C. Thiamine, vitamin B1. D. Phenytoin, Dilantin. Answer: B. Lorazepam, Ativan. This question tests the nurse's ability to recognize and prioritize treatment for alcohol withdrawal delirium, delirium tremens. The keywords agitated, confused, seeing bugs, tremors, diaphoresis are classic signs of severe alcohol withdrawal, which can rapidly progress to seizures and cardiovascular collapse. Benzodiazepines like lorazepam are the first-line treatment for alcohol withdrawal to reduce central nervous system hyperexcitability and prevent seizures. While thiamine is important to prevent Wernicke-Korsakoff syndrome, and haloperidol might be used for severe agitation after benzodiazepines, immediate suppression of withdrawal symptoms with a benzodiazepine is the priority to stabilize the client and prevent life-threatening complications. Always remember that benzodiazepines are the cornerstone of treatment for acute alcohol withdrawal syndrome to manage symptoms and prevent seizures. Question 6. A client in the intensive care unit has a continuous 4 infusion of heparin. The nurse notes the client's activated partial thromboplastin time, APTT, is 120 seconds, therapeutic range, 60 to 80 seconds. The client has no signs of bleeding. Which action should the nurse take first? A. Discontinue the heparin infusion immediately. B. Administer protamine sulfate as per protocol. C. Notify the healthcare provider and anticipate a dose adjustment. D. Prepare to draw a new APTT level in 1 hour. Answer: C. Notify the healthcare provider and anticipate a dose adjustment. This question assesses the nurse's critical thinking regarding continuous heparin infusions and laboratory monitoring. The keyword first indicates the most appropriate immediate action. An APTT of 120 seconds is critically elevated, placing the client at a very high risk for bleeding, even without current overt signs. The nurse's immediate priority is to notify the healthcare provider to get an order for a heparin dose adjustment. While stopping the infusion might be part of the physician's order, it should not be done without an order unless the client is actively bleeding. Administering protamine sulfate is for overt bleeding or severe overdose, not routine APTT adjustments. A new APTT should be drawn after a dose adjustment, not before notifying the provider of the critical value. Always communicate critical lab values and potential risks to the healthcare provider promptly to ensure timely and appropriate interventions. Question 7. The nurse is assessing a 4-year-old child admitted with dehydration due to prolonged vomiting and diarrhea. Which assessment finding is the most concerning and requires immediate intervention? A. Decreased urine output, oliguria. B. Capillary refill time of 4 seconds. C. Presence of sunken fontanelle. D. Absence of tears when crying. Answer: B. Capillary refill time of 4 seconds. This question tests the nurse's ability to prioritize assessment findings indicating severe dehydration in a pediatric client. The keyword "most concerning" highlights the need to identify the sign indicating the most significant hemodynamic compromise. A capillary refill time of 4 seconds is a critical indicator of poor peripheral perfusion and impending circulatory collapse, shock, in a child, signifying severe dehydration that requires immediate fluid resuscitation. While decreased urine output, sunken fontanelle, and absence of tears are all signs of dehydration, a prolonged capillary refill time reflects inadequate tissue perfusion more directly and urgently than the others. Always prioritize signs that indicate compromised circulation and risk of shock in pediatric clients. Question 8. A client is admitted with symptoms of an acute asthma exacerbation. The nurse administers a nebulized albuterol treatment. Which assessment finding immediately after the treatment indicates the most effective response? A. Decreased wheezing and improved air movement on auscultation. B. Oxygen saturation increased from 88% to 92%. C. Client states, "I can breathe a little easier now." D. Respiratory rate decreased from 30 breaths/min to 24 breaths/min. Answer: A. Decreased wheezing and improved air movement on auscultation. This question evaluates the nurse's ability to assess the direct physiological effectiveness of a bronchodilator in an asthma exacerbation. The keyword "most effective response" means identifying the objective sign of improved airflow. Albuterol is a bronchodilator, and its primary action is to open constricted airways. The most direct and objective evidence of improved bronchodilation is a decrease in wheezing, caused by air moving through narrowed airways, and, more importantly, improved air movement throughout the lung fields on auscultation, indicating less airway obstruction. While the other options are positive signs, they are secondary effects. Direct auscultation provides the most immediate and accurate assessment of treatment efficacy. Always listen to lung sounds before and after bronchodilator administration to determine the direct impact on airway patency. Question 9. A client with a new diagnosis of type 2 diabetes mellitus is learning to self-administer insulin glargine. The nurse observes the client performing the injection. Which action by the client requires the nurse to intervene immediately? A. The client injects the insulin into the deltoid muscle. B. The client rotates injection sites within the same general area. C. The client does not aspirate before injecting the insulin. D. The client administers the insulin at room temperature. Answer: A. The client injects the insulin into the deltoid muscle. This question assesses the nurse's knowledge of proper insulin administration technique and safety. The keyword "intervene immediately" indicates a critical error that could lead to adverse outcomes. Insulin glargine, Lantus, is a long-acting insulin designed for subcutaneous administration, not intramuscular. Injecting insulin into a muscle, like the deltoid, can cause rapid absorption and a sudden drop in blood glucose, hypoglycemia, which is dangerous and can be life-threatening. The other actions, rotating sites, not aspirating subcutaneous injections, administering at room temperature, are correct or acceptable practices for insulin administration. Always ensure clients understand the correct injection depth and site for insulin to prevent rapid absorption and hypoglycemia. Question 10. A client undergoing chemotherapy for leukemia develops a sudden onset of fever, chills, and productive cough. The nurse notes crackles in the right lower lobe. The client's absolute neutrophil count, ANC, is 400 cells/mm superscript 3. Which nursing action is the highest priority? A. Administer ordered antipyretics to reduce fever. B. Initiate airborne precautions for suspected pneumonia. C. Obtain sputum and blood cultures, then administer prescribed broad-spectrum antibiotics. D. Prepare the client for immediate transfer to the intensive care unit. Answer: C. Obtain sputum and blood cultures, then administer prescribed broad-spectrum antibiotics. This question tests the nurse's prioritization in a neutropenic, immunocompromised client with signs of infection. The keywords highest priority indicate the most crucial action to prevent rapid deterioration. A client with leukemia undergoing chemotherapy and an ANC of 400, neutropenia, who develops fever and signs of pneumonia has a neutropenic fever, which is a medical emergency. The priority is to obtain cultures before administering broad-spectrum antibiotics to identify the causative organism, followed immediately by antibiotic administration to combat the infection. Delaying antibiotics can lead to rapid sepsis and death. While antipyretics are important, treating the underlying infection is paramount. Airborne precautions are typically for specific diseases like TB, not general pneumonia, and immediate ICU transfer is usually for clients in severe respiratory distress or septic shock, not the initial response to suspected infection. For immunocompromised clients, rapid identification and treatment of infection are life-saving. Question 11. The nurse is caring for a client with a nasogastric, NG, tube connected to low intermittent suction after abdominal surgery. The client reports increasing abdominal pain and distension. The nurse assesses the NG tube and notes no drainage. Which action should the nurse take first? A. Increase the suction setting to continuous suction. B. Irrigate the NG tube with 30 milliliters of normal saline. C. Reposition the client to promote drainage. D. Administer a prescribed opioid analgesic for pain. Answer: B. Irrigate the NG tube with 30 milliliters of normal saline. This question assesses the nurse's problem-solving skills for a common complication of NG tube management. The keywords increasing abdominal pain and distension combined with no drainage from the NG tube strongly suggest the tube is obstructed. The first action should be to attempt to restore patency. Irrigating the NG tube with normal saline is the appropriate initial step to clear a potential blockage, allowing gastric contents to drain and alleviate the client's symptoms. Increasing suction or repositioning might be tried if irrigation fails, and administering an analgesic without addressing the underlying cause of obstruction is inappropriate and delays necessary intervention. Always troubleshoot an NG tube for patency when a client experiences symptoms of obstruction. Question 12. A client is admitted with heart failure exacerbation. The nurse notes the client has bilateral +3 pitting edema, crackles in both lung bases, dyspnea at rest, and an S3 heart sound. Which medication administration should the nurse question if prescribed for this client? A. Furosemide 40 mg 4 push. B. enalapril 5 mg PO daily. C. Metoprolol 25 mg PO bid. D. Ibuprofen 400 mg PO PRN for pain. Answer: D. Ibuprofen 400 mg PO PRN for pain. This question tests the nurse's knowledge of medications contraindicated in heart failure. The concept being tested is drug safety in clients with compromised cardiac function. Ibuprofen, a nonsteroidal anti-inflammatory drug, NSAID, is generally contraindicated or used with extreme caution in clients with heart failure. NSAIDs can cause sodium and water retention, which can worsen fluid overload and exacerbate heart failure symptoms like edema and dyspnea. They can also reduce the effectiveness of diuretics and ACE inhibitors. The other medications listed, furosemide, enalapril, metoprolol, are standard treatments for heart failure, aimed at reducing fluid volume, improving cardiac output, and reducing cardiac workload. Always be vigilant for medications that can worsen fluid retention in heart failure clients. Question 13. A client with a history of intravenous drug use is admitted with acute infective endocarditis. The client has a fever of 102.5 degrees Fahrenheit 39.2 degrees Celsius, generalized weakness, and a new cardiac murmur. The nurse knows that prompt intervention is crucial to prevent which serious complication? A. Deep vein thrombosis. B. Cerebral emboli. C. Renal calculi. D. Peripheral neuropathy. Answer: B. Cerebral emboli. This question assesses the nurse's understanding of the most critical complication associated with infective endocarditis. Infective endocarditis involves microbial vegetations forming on heart valves. These vegetations can easily dislodge and travel through the bloodstream as emboli. The keywords acute infective endocarditis and new cardiac murmur indicate active infection on heart valves. The most serious and common embolic complication, especially with left-sided endocarditis, is a stroke caused by cerebral emboli, which can lead to permanent neurological deficits or death. While other complications can occur, cerebral emboli present the most immediate and devastating threat. Always be alert for signs of neurological changes in clients with endocarditis, as this may indicate an embolic event. Question 14. A nurse is providing discharge teaching to a client with a new colostomy. The client expresses significant distress and states, "I don't know how I'll ever live with this bag. My life is over." Which nursing response is most appropriate? A. Many people live full lives with a colostomy. You'll get used to it. B. It sounds like you're feeling overwhelmed. What are your biggest concerns right now? C. Perhaps we can arrange for a visit from a colostomy support group member. D. Let's review the steps for changing your colostomy bag again. Answer: B. It sounds like you're feeling overwhelmed. What are your biggest concerns right now? This question tests the nurse's therapeutic communication skills and ability to respond to a client experiencing distress. The client's statement expresses significant emotional pain and hopelessness regarding their new colostomy. The most appropriate response is one that acknowledges the client's feelings, validates their experience, and opens a pathway for them to express specific concerns. This open-ended, empathetic response allows the nurse to understand the client's immediate needs and tailor support accordingly. The other options are either dismissive, premature, or focus on tasks rather than the client's emotional state, potentially shutting down communication. Always prioritize validating a client's feelings and encouraging them to express their concerns when they are in distress. Question 15. The nurse is caring for a client with syndrome of inappropriate antidiuretic hormone, SIAD. The client's serum sodium is 118 milliequivalent/L. Which prescription should the nurse question? A. Administering a hypertonic saline infusion. B. Restricting oral fluid intake to 800 milliliters per day. C. Administering a loop diuretic such as furosemide. D. Providing free access to water at the bedside. Answer: D. Providing free access to water at the bedside. This question evaluates the nurse's understanding of the pathophysiology and management of SIADH. The concept is that SIAD causes excessive secretion of ADH, leading to water retention and dilutional hyponatremia, low sodium. The keyword question indicates identifying an inappropriate action. Providing free access to water would worsen the hyponatremia by increasing free water intake, further diluting serum sodium levels, which is precisely what needs to be prevented in SIADH. The other interventions, hypertonic saline, fluid restriction, loop diuretics, are all appropriate treatments for SIAD with severe hyponatremia to correct the fluid imbalance and raise serum sodium. Always remember that fluid restriction is a cornerstone of SIAD management to prevent further dilution of sodium. Question 16. A client is admitted to the emergency department with a severe anaphylactic reaction after being stung by a bee. The client is hypotensive, tachycardic, and has diffuse urticaria and angioedema. Which medication should the nurse anticipate administering first? A. Diphenhydramine, Benadryl. B. Epinephrine, adrenaline. C. Hydrocortisone, Solucortef. D. Albuterol, Prevental. Answer: B. Epinephrine, adrenaline. This question tests the nurse's knowledge of the immediate management of a life-threatening anaphylactic reaction. The keywords severe anaphylactic reaction, hypotensive, and tachycardic indicate profound circulatory and respiratory compromise. Epinephrine is the first-line and most critical medication for anaphylaxis because of its immediate vasoconstrictive and bronchodilating effects, which counteract the severe hypotension and airway constriction. While antihistamines, corticosteroids, and bronchodilators are important, they act too slowly or do not address the acute circulatory collapse. Administering epinephrine without delay can be life-saving by stabilizing the client's airway and circulation. Always prioritize epinephrine administration in severe anaphylaxis to reverse life-threatening symptoms. Question 17. The nurse is preparing a client for discharge following a myocardial infarction, MI. The client expresses anxiety about resuming sexual activity. Which teaching point is most appropriate for the nurse to provide? A. You should avoid sexual activity for at least 6 months after your MI. B. If you can walk up 2 flights of stairs without chest pain, you can safely resume sexual activity. C. Sexual activity is generally safe once you can perform light exercises without discomfort. D. You should check your pulse before and after sexual activity to ensure it's within safe limits. Answer: B. If you can walk up 2 flights of stairs without chest pain, you can safely resume sexual activity. This question assesses the nurse's ability to provide accurate and practical guidance regarding post-MI activity. The concept being tested is safe resumption of normal activities after a cardiac event. The most appropriate teaching point should offer a clear, functional benchmark for assessing cardiac tolerance. The ability to climb 2 flights of stairs or walk briskly for 1 block without chest pain, dyspnea, or palpitations is a common and practical guideline for assessing the cardiac workload equivalent to sexual activity, indicating when it is safe to resume. The other options are either too restrictive, too vague, or focus on monitoring rather than readiness. Providing a concrete, actionable benchmark helps clients feel confident about resuming activities. Question 18. A client with chronic obstructive pulmonary disease, COPD, is prescribed oxygen therapy at 2 liters per minute via nasal cannula. During a routine assessment, the nurse finds the client's respiratory rate is 8 breaths/min and oxygen saturation is 99%. Which action should the nurse take first? A. Increase the oxygen flow rate to 4 liters per minute. B. Encourage the client to deep breathe and cough. C. Assess the client's level of consciousness and notify the healthcare provider. D. Document the findings as expected for a COPD client on oxygen. Answer: C. Assess the client's level of consciousness and notify the healthcare provider. This question assesses the nurse's understanding of oxygen therapy in COPD and the potential for carbon dioxide retention. The keywords respiratory rate is 8 breaths/min and oxygen saturation is 99% are critical. A respiratory rate of 8 breaths/min is bradypnea and indicates significant respiratory depression, even with a high oxygen saturation, suggesting potential CO2 narcosis in a COPD client who relies on a hypoxic drive to breathe. The nurse's immediate priority is to assess the client's neurological status, level of consciousness, to determine the severity of respiratory depression and then promptly notify the healthcare provider for intervention. Increasing oxygen or delaying notification could worsen the situation, and these findings are not expected or benign. Always suspect CO2 retention in a COPD client with a low respiratory rate and normal or high oxygen saturation, and act quickly. Question 19. A client is admitted with a severe gastrointestinal bleed, requiring multiple units of packed red blood cells. After receiving 4 units, the client develops petechiae, oozing from the foresite, and an elevated prothrombin time, PT, and activated partial thromboplastin time, APTT. Which complication should the nurse suspect? A. Transfusion-associated circulatory overload, TACO. B. Disseminated intravascular coagulation, DIC. C. Acute hemolytic transfusion reaction. D. Thrombotic thrombocytopenic purpura, TTP. Answer: B. Disseminated intravascular coagulation, DIC. This question tests the nurse's ability to identify a serious complication in a critically ill client receiving multiple blood products. The keywords severe GI bleed, multiple units of PRBCs, and new onset petechiae, oozing from foresite, elevated PT/APTT are classic signs of disseminated intravascular coagulation, DIC. DIC is a life-threatening disorder where widespread activation of clotting factors leads to microthrombi formation, consuming clotting factors and platelets, followed by paradoxical bleeding. The client's initial bleeding followed by new, widespread bleeding with abnormal coagulation times points directly to DIC. TACO would manifest as fluid overload, hemolytic reactions involve fever/chills/back pain, and TTP presents with different symptoms. Recognizing the dual presentation of clotting and bleeding, especially in a critically ill client, is key to suspecting DIC. Question 20. The nurse is caring for a client with a C5 spinal cord injury sustained 2 days ago. The client reports a sudden, pounding headache, is diaphoretic above the injury level, and has a blood pressure of 180/96 mmHg. Which action should the nurse take first? A. Administer a prescribed antihypertensive medication. B. Elevate the head of the bed to 90 degrees. C. Check for a full bladder or bowel impaction. D. Loosen any tight clothing or restrictive devices. Answer: C. Check for a full bladder or bowel impaction. This question assesses the nurse's ability to recognize and prioritize interventions for autonomic dysreflexia, a medical emergency in clients with spinal cord injuries at T6 or above. The symptoms of pounding headache, diaphoresis above the injury, and severe hypertension are classic signs of autonomic dysreflexia. The first action is to identify and remove the noxious stimulus. The most common triggers are bladder distension, example kinked catheter, full bladder, or bowel impaction. While elevating the head of the bed and loosening clothing are also crucial immediate steps, addressing the underlying cause, example bladder/bowel, is paramount. Antihypertensives might be needed but only after trying to remove the stimulus. Always look for and address common triggers for autonomic dysreflexia first. Question 21. A client with liver cirrhosis and ascites is prescribed spironolactone 100 mg orally daily. Which laboratory finding indicates a potential adverse effect of this medication that the nurse should report? A. Serum potassium 5.5 milliequivalent/L. B. Serum sodium 138 milliequivalent/L. C. Blood urea nitrogen, BUN, 15 mg per deciliter. D. Serum albumin 3.0 g/dl. Answer: A. Serum potassium 5.5 milliequivalent/L. This question tests the nurse's knowledge of the adverse effects of spironolactone, a potassium-sparing diuretic, especially in the context of liver disease. The keywords potential adverse effect and spironolactone point to its impact on electrolyte balance. Spironolactone can cause hyperkalemia, elevated potassium levels, because it conserves potassium while promoting sodium and water excretion. A serum potassium level of 5.5 milliequivalent/L is above the normal range and indicates hyperkalemia, which can lead to dangerous cardiac arrhythmias. The other lab values, normal sodium, normal BUN, slightly low albumin, are either within normal limits or expected findings in liver cirrhosis, not direct adverse effects of spironolactone. Always monitor potassium levels closely when administering potassium-sparing diuretics. Question 22. A client is receiving a continuous infusion of dopamine at 10 micrograms per kilogram per minute for severe hypotension. The nurse notes the client's intravenous, site is cool, pale, and edematous, and there is no blood return when attempting to aspirate. Which action should the nurse take immediately? A. Apply warm compresses to the site and elevate the extremity. B. Decrease the dopamine infusion rate to the lowest setting. C. Discontinue the current for infusion and prepare to administer phentolamine into the extravasated area. D. Aspirate any residual dopamine from the line and flush with normal saline. Answer: C. Discontinue the current for infusion and prepare to administer phentolamine into the extravasated area. This question assesses the nurse's knowledge of managing extravasation, specifically with a potent vasoconstrictor like dopamine. The keywords cool, pale, edematous, and no blood return strongly indicate extravasation, where the medication has leaked into the surrounding tissues. Dopamine is a vesicant that can cause severe tissue necrosis. The immediate action is to stop the infusion and then, as per protocol, prepare to administer phentolamine, an alpha blocker, as an antidote to counteract the vasoconstriction and prevent tissue damage. Applying warm compresses, decreasing the rate without stopping, or flushing are insufficient and delay critical intervention. Always prioritize stopping the infusion and administering the appropriate antidote for vesicant extravasation to minimize tissue injury. Question 23. A client with a long history of poorly controlled hypertension is admitted to the emergency department with sudden onset of severe headache, blurred vision, and dizziness. The client's blood pressure is 220/120 mmHg. Which is the nurse's priority action? A. Administer oral nifedipine immediately. B. Prepare to administer intravenous labetalol or nicardipine. C. Recheck the blood pressure in 15 minutes to confirm the reading. D. elevate the head of the bed and provide a quiet environment. Answer B. Prepare to administer intravenous labetalol or nicardipine. This question tests the nurse's ability to recognize and prioritize intervention for a hypertensive crisis with target organ damage. The keywords sudden onset of severe headache, blurred vision, dizziness combined with a blood pressure of 220/120 mmHg signify a hypertensive emergency, indicating acute target organ damage, neurological and potentially ocular. In this critical situation, rapid but controlled reduction of blood pressure is necessary to prevent further organ damage. Intravenous antihypertensives like labetalol or nicardipine are the medications of choice for their rapid onset and titratability. Administering oral medications would be too slow, and delaying intervention to recheck or provide comfort measures would be inappropriate for an emergency. Recognize that signs of target organ damage with severe hypertension demand immediate medication administration to prevent catastrophic outcomes. Question 24. The nurse is caring for a client with a large, non-healing pressure injury on the sacrum. The wound has a foul odor, copious purulent drainage, and significant tunneling. The client's white blood cell, WBC, count is elevated. Which type of dressing would the nurse anticipate the healthcare provider to prescribe first? A. Hydrocolloid dressing. B. Transparent film dressing. C. Alginate or hydrofiber dressing. D. Hydrogel dressing. Answer C. Alginate or hydrofiber dressing. This question assesses the nurse's knowledge of appropriate wound care dressings based on wound characteristics. The keywords large, non-healing pressure injury, foul odor, copious purulent drainage, and significant tunneling indicate a highly exuding, likely infected wound with depth. Alginate and hydrofiber dressings are highly absorbent, conform to wound beds, including tunneling, and absorb copious exudate, making them ideal for heavily draining wounds while also promoting autolytic debridement. These dressings are also excellent for packing tunneled wounds. Hydrocolloid and transparent film dressings are for minimal to moderate exudate, and hydrogel is for dry or minimally exuding wounds. Always choose a dressing that matches the wound's specific needs, especially for exudate management and cavity filling. Question 25. A client diagnosed with delirium is experiencing fluctuating levels of consciousness, disorientation, and hyperactive behavior with vivid hallucinations. Which nursing intervention is most appropriate for promoting the client's safety? A. Administering PRN sedatives to keep the client asleep. B. Placing the client in a room with a window view and frequent reorientation. C. Applying wrist restraints to prevent falls and pulling out lines. D. Maintaining a consistent, well-lit environment and limiting unnecessary stimulation. Answer D. Maintaining a consistent, well-lit environment and limiting unnecessary stimulation. This question tests the nurse's understanding of non-pharmacological interventions for a client with delirium, prioritizing safety. The keywords delirium, fluctuating levels of consciousness, disorientation, and hyperactive behavior with vivid hallucinations describe the acute confusional state. The most appropriate intervention for safety in delirium is often environmental modification. A consistent, quiet, and well-lit environment helps minimize sensory misinterpretation and reduce agitation, thereby decreasing the risk of falls or self-harm without relying on restraints or excessive sedation. While reorientation is helpful, frequent reorientation can sometimes increase agitation. Restraints are a last resort and can worsen agitation, and sedatives should be used cautiously as they can prolong delirium. Always prioritize environmental modifications and reorientation to reduce agitation and promote safety in clients with delirium.